Hello, everybody. I just wanted to say I'm watching the clock and I'm waiting another minute, maybe at most, as we're gathering a lot of sign-ins. And I'd like to get started on time because we have an exciting session to proceed with. But I will give it another minute and then make my very brief introduction. Okay, I think the traffic has come to a slower rate at this point in terms of sign-ins, so I will get started. I'm Armine Kazanjian, as you see from the scripts and information on the screen. I am professor at the School of Population Public Health at UBC. And I am co-lead with Jennifer Jones on the CCSRC Consortium activities. We have been going on for a while, and some of you are continuing members who participate on a monthly basis. And I'm welcoming all of you who are new to the CCRC rounds. We have a very exciting program, as I said earlier. I will, when I stop, our moderator, who is today Mayanne Marks, our business manager from UHN, will run the show. So we have a very skilled and talented moderator who will make sure that everything gets done properly. She will also monitor some of the, I guess, comments in chat, and so will I. And thank you in advance to Mayanne for taking this on for this week and for this month. This is the first of the 2024 series, and so we're looking forward to the next few months of very exciting talks. The talk today is Improving Cancer Survivorship as Stewards of the Canadian Strategy for Cancer Control by our very able group of presenters from CPAC. This will be, and again, as I say, I'm very, very excited. I will not do the introductions of 5 speakers. They will introduce themselves as they come on. And one last thing that I would want to say right now is that I would like to end my 2 minutes by acknowledging that the land on which I work and study and play is the unceded traditional territory of the Coast Salish people, the Point Grey campus, including the traditional territories of Musqueam, Squamish, and Tsleil-Waututh nations. I will stop here and encourage people who would want to make acknowledgements to put it on the chat for the benefit of everyone to see and read. Thank you, and over to you. I'm going to say Mayanne, but she probably has a different plan for me in terms of getting started with the CPAC group. So go ahead.
The CPAC group can go ahead and start presenting. Thanks, Armine.
Okay. Hello, everyone. I'm Kim Badovanak, and on behalf of my colleagues, Tanya Flanagan, Jessica Kitchen, Kim Tran, and Amanda Warner, I'd like to thank you for inviting us to speak today to provide an update on the Canadian Partnership Against Cancer's work in the survivorship arena. Is that advancing or not?
Not yet.
Not yet. Okay, what's going on here? It was working. There we go. So I just want to let you know that it's going to be largely an informational presentation, although we will be seeking your input on indicator concepts, which will be elaborated in the third presentation by Jessica. So my presentation today will focus on the data available from the Canadian Cancer Research Survey, or CCRS. This was initiated in 2005, and it was the first joint activity undertaken by the cancer research community. It was designed to quantify how much of the funded peer review research was relevant to cancer and to help identify gaps or areas where targeted funding or resources would be needed. The CCRS has 17 years of data and contains over 30,000 research projects funded by more than 40,000 organizations and programs. And collection and classification of the calendar year data for 2022 is underway. So before I begin, some context setting. The Canadian Partnership Against Cancer supports cancer agencies and programs, health system partners, and communities across provinces and territories with funding, skills, resources, and evidence to develop sustainable solutions, take action, and improve cancer outcomes. While we don't deliver patient care directly, we work alongside partners to advance pan-Canadian cancer priorities and implement initiatives to ensure equity of access, experience, and outcomes for cancer care for everyone, with an emphasis on everyone, because we're big on ensuring equity of access, and we do all this within the confines of a sustainable healthcare system. The partnership's approach is strength-based, evidence-led, and inclusive. In our work, we build on the unique and diverse strengths of partners and draw from the latest research and knowledge. We champion efforts that close gaps in the cancer care outcomes of First Nations, Inuit, and Métis, and equity-deserving populations. This will be familiar to many of you. By supporting partners across the country to advance the pan-Canadian priorities and actions set out in the Canadian Strategy for Cancer Control, we strive to ensure that fewer people in Canada develop cancer, more people in Canada survive cancer, people in Canada affected by cancer have a better quality of life, and all people in Canada have equitable access to high-quality cancer care no matter where they live. So just to let you know that the strategy identifies research as a critical enabler, and with the support of the Canadian Cancer Research Alliance, that is part of its remit. That's just sorry about that. That's just a quote from the strategy. So CCRA, I know some of you will be familiar with CCRA. CCRA is really an alliance of organizations. We include federal research programs and agencies, provincial research agencies, provincial cancer care agencies, cancer charities, and other voluntary associations that strategically align on cancer research priorities and coalesce around a common vision for cancer research. Our vision, Discover Together, this is really an aspirational vision of cancer research, which puts people at the center of the research system. And naturally, that includes people living with and beyond cancer, their families, and caregivers. In 2017, the CCRA released a pan-Canadian framework for cancer survivorship research to help prioritize research investment in this area. Creation of the framework was one of the actions in the CCRA's strategic plan called Target 2020. Project sponsors at that time were Esther Green, past director of the Person-Centered Perspective at CPAC, and Micah Oshinchuk, former CEO at Alberta Cancer Foundation. The framework was prepared by Robin Urquhart and her team in consultation with a working group of CCRA members, representatives, experts, and other advisors. And these are the main themes coming from that framework. And the terminology might be a little bit dated, but I think many of the concepts of the framework still resonate today. The investment in cancer survivorship research was identified as a specific area of interest by the CCRA members many years ago. The initial report focused on cancer survivorship research. It was published in 2011 for data years 2005 to 8. And in addition to the CCRA members, this initial report was informed and reviewed by Nicole Koulos-Reed, Richard Dahl, Mark Fitch, Jennifer Jones, and Irene Nickel. The CCRA has continued to report on the investment in cancer survivorship research, although the outputs have changed from very voluminous tomes to brief reports, PowerPoint decks, and an interactive visualization using Tableau. Reports are available in both official languages, and the recent analysis spans the years 2005 to 2021 and compares 3 5-year time periods, 2007 to 2011, 2012 to 2016, 2017 to 2021. In these reports, we use a specific classification which was developed to aid in the analysis of the research projects. So projects are classified according to target population, in this case, patients versus family caregivers, research type, various types listed there, and research focus. This same classification is applied to the research relevant to palliative and end-of-life cancer care, which we report in a separate way. Very importantly, when reviewing these analyses that I'm going to present shortly, I want you to bear in mind some caveats that obviously we are tracking 40 organizations, but not all funders that would fund in this area. So institutional funding, private philanthropies, other organizations would not be captured, and that may affect the overall results. That we do not receive data from BC Cancer and its foundation, so BC figures may be underrepresented. And we do the geographic classification on the basis of the nominated PI. And so if there's multi-jurisdictional projects, it may not be an accurate reflection. So with those caveats in mind, I'm going to present some of the analyses. So if you hope you can see the top part of this graph. So this is really tracking over time from 2005 to 2021, the investment in cancer survivorship research. That's the top line in the blue. The bottom in the gray is the overall cancer research investment. And you can see that the trends diverge. Obviously, the axes are different, but the trends diverge, and that's important because if you look at the bottom circles, you see that cancer survivorship research reflects a growing proportion of the overall total investment. And over 17 years, a total of $340 million has been invested in cancer survivorship research, and that represents overall 4% of the cancer research investment. This, I think, is the most important chart from my perspective. This is a collection of graphs that shows the contribution of targeted funding programs to the investment in survivorship research. And I think there's two important takeaways, and one is pretty evident. Targeted programs are an important source of research support, and targeted programs help to build capacity so that survivorship researchers are more competitive in open competitions. And I think you can see that quite nicely here in the is this working here? Where we go here, where you see that this line of non-targeted goes dramatically up, showing increased capacity. This next graph, sorry, it's a little bit busy. It's showing the top funders of survivorship research among those tracked in the survey. And although it's only reflecting the top ones, I should say that of our 40 organizations, most actually have funded some kind of cancer survivorship research at some point in the 17 years. Well over half of the research investment, if you combine our two top organizations, CIHR and CCS, they account for 61% of the investment. Collectively, funders within the federal government and their corresponding programs represented well over 40% of the investment, regardless of the time period that you look at. And while the investment in from the charitable sector shrunk proportionately, I should say that the dollar value of the cancer survivorship investment remained constant. So in this graph and the following one, you'll see in the table, those are the 3 periods, and those are these are all proportions or percents. And you will see that that's showing the distribution by the research type. So the various types, and in this graph, the donut graph is just the 2021, so the most recent year we have. And you can see that testing of new approaches to support cancer survivors, which is critically important, represents about 4 out of every $10 invested in cancer survivorship in 2021. This is the same organization, so table presenting the 3 periods and the donut graph presenting the 2021 data, and you'll see that there's been substantial increases in investment in, I've called it physiological, but physical effects and care delivery access and quality. In terms of physical effects, I will say that there was a large investment in cardiotoxicity. when we look at the survivorship investment by cancer site, and this again is showing the 3 different periods, you see that regardless of the period, the most substantial investment is in breast cancer. But it is very revealing that you have a big increase from the first to the second in prostate cancer and then in leukemias, and then this very interesting, and obviously with the federal investment in ovarian cancer, we've seen quite a bit of that investment going to survivorship. In this graph, I'm presenting just the most recent period, and it's looking at nominated principal investigators. So over the total of 17 years, there were 523 nominated principal investigators who received 1 or more awards or grants focused on survivorship. And this graph looks at the most recent period, and there were 280 nominated PIs and 40% working in Ontario. I will point out, as per the caveats that I stated earlier, that it's likely an underrepresentation for BC, but it also, this graph, I think, demonstrates that Alberta has definite bench strength in terms of cancer survivorship research. Although trainees are supported from diverse sources, like provincial or institutional programs, obviously internships and operating grants, there are, as you know, a small group of trainees who receive awards through peer review processes. So this graph's only looking at just that slice of trainee support. So over 17 years, there were 560 trainees, and they received 723 awards. And when we examine by period, the investment shows an increase of about $5 million in the latest 5-year period. And this, again, is a good indicator of increased or growing researcher capacity. And finally, before I pass the baton to Amanda, I just want to let you know that all of this data is available on the CCRA website. And if there's something not here that your consortium would like me to prepare or analyze for you, just feel free to reach out and I can certainly do that for you. So I'm going to turn it over to Amanda.
Thank you so much, Kim. And thank you everyone for joining today. I am joining from our transitions and care team at the partnership along with Tanya Flanagan. And over the next few slides, I'll just talk through a few of the program level initiatives that we have supported in survivorship over the past several years. So next slide, just an overview of where we're going. I'll start with the transition study, which many of you may already be familiar with. And then I'll talk through our survivorship efforts in mental health, some implementation initiatives across the country, and then I'll briefly touch on our current work. So starting with the experiences of patients in transition study. Prior to this study, the partnership had done significant pan-Canadian work in the survivorship space, but there was really limited data to tell the story about the needs and preferences of survivors themselves. It was a bit of a black box. So we conducted the study in 2016, and we heard from over 13,000 respondents across all provinces. The territories were not included in this study. And the population included both adult and young adult cancer survivors 1 to 3 years post-treatment. What's especially unique about this study is that the full anonymized data set is freely available for researchers and policymakers on request. And the form to request the data set is right on the slide here. I'll have a number of links throughout this presentation, so please don't worry about writing them all down. I'll put them all in the chat at the end. To date, there have been 32 peer-reviewed publications based off the data set on a range of topics. And as of this winter, we've had our very first master's thesis study based on the data set. Beyond this, oh, sorry, I'm not quite done. Beyond this, we know that countless others have used the data for internal program planning and business cases. And we do also have a report on our website based off the data that focuses specifically on the emotional challenges of adult survivors, which you can also find at the link below. Those who have explored the data already will know it's a very long survey. It includes qualitative as well as quantitative responses, and it really runs the gamut from survivorship care plans, to informational needs, to insurance coverage and internet and social media usage. It's very extensive. So on to the next one. We report the study results broadly, often based on 3 bucket categories: emotional, physical, and practical concerns of cancer survivors. And just as a small taste, I'll talk about some of the most common things that we see in the data for adults, and then on the next slide, we'll talk about young adults. We found that the vast majority of adults report having at least one emotional concern, but, and this is a reoccurring theme in the study, these needs are often not being met, and many of these patients are not seeking help for those concerns from any source. We also know that today, healthcare capacity pressures and human resources challenges are at the top of mind across the country. This data set's from 2016, so we can only imagine what these patient experiences look like now in the country today. For adults, we see changes with sexual activity and fatigue are really important. Again, a lot of these needs are not being met, and even for those that do seek help, many say that their concerns were normal, they're told it's normal, and they didn't think anything could be done about it, which is pretty heartbreaking. For practical concerns, we commonly see returning to work or school, paying for healthcare bills, and getting life or health insurance is important. For adolescents and young adults, on the next slide. Next slide. Oh, I don't see it.
Not going. Oh my gosh. Sorry, it's sticking. There. Oh,
Great, thank you.
is that it? Okay.
Perfect. For adolescents and young adults, we see here the number reporting that they have at least one emotional concern rises from almost 80% with adults up to 90% for AYA. And those emotional concerns are often anxiety and worry about cancer recurrence. Many AYA also report challenges with fertility preservation. And again, many of them that don't seek help with the physical concerns they face are told these symptoms are normal. And I will also talk a little bit more about our oncofertility initiatives with AYA in some of the later slides. And for practical concerns, many report returning to work or school is a challenge. So on the next one, stemming from the experiences of patients in transition study data, the organization decided to focus its efforts on the unmet emotional needs of cancer survivors. So we convened a cancer survivorship and mental health working group with pan-Canadian representation to support mental health activities from 2020 to 2022. A few of the knowledge products that came out of this stream of work are shown on the slide here. We collaborated with the Mental Health Commission of Canada on a very large scoping review, which included a synthesis of over 800 research documents, and a number of conclusions and policy recommendations are within. It's a pretty weighty document, so we also have 2 companion quick facts documents. Those are the 2 screenshots on the right of this slide, and they are on mental health and cancer, and also mental health and chronic disease. They give a brief summary of the report. We also commissioned an environmental scan on mental health and return to work needs of cancer survivors. The document provides a review of existing programs in Canada and internationally, and it is informed by key informant interviews. It includes a number of findings on factors for successful psychosocial cancer survivorship programs. Next, simultaneous to our mental health focus, we also supported a number of cancer survivorship implementation initiatives. In Quebec, our partners designed and implemented a post-treatment transition letter program at 3 pilot sites, and they do have plans to expand that across the province as well. The program design includes a risk stratification model and assessment of patient self-care capacity. It's based on functional abilities, concerns, and personal resources. The information then feeds into a personalized support guide for each patient that they can take home. And the idea here is that based off the patient's assessment results, they're directed to different follow-up care pathways types of follow-up care providers, and supportive services. Within this program, family doctors also receive a medical follow-up plan, and that includes a section on post-treatment symptom management. It's in a checklist format, which is tailored to the patient. And with this program as well, our partners compiled a toolkit with all the information they used to develop the program. There's some screenshots here on this slide. It includes template assessments, clinical forms, project management structure, and more. And the aim here is that institutions can use the toolkit to implement similar programs in their organizations without having to reinvent the wheel. I regret to inform you, however, that it is not yet online, as we are currently in the process of translating all the materials into English. So please stay tuned for that. Next, in Alberta, we supported the change management portion of a very similar program. Their program also included information tailored separately to the patient and to the primary care physician providing follow-up care. They had letters sent to both of them at 2 or 3 different time points to communicate to both about the shared responsibilities, who's responsible for what, symptoms to look out for, surveillance, and next steps. And this was also a province-wide program. The structure for this program is a little different, as they have clinical pathway guidelines and letter templates created separately for each cancer. And then at the end of the project, they had completed this for the most 14 common types of cancer, as well as a generic letter for other types. Next slide. In Alberta, the project also included a major website update to include information tailored specifically to the follow-up primary care provider. And this website emerged out of those change management efforts that the partnership funded to ensure that those transition letters that they implemented were effective. The site offers a one-stop shop with survivorship guidelines, post-treatment surveillance, resources, and information. And it was really co-designed with input from stakeholders themselves, those primary care providers, based on what they needed and what they wanted. And the link to that website is here as well. Next, we also worked with the Canadian Cancer Society to improve access to local supportive resources and patient navigation. The project included the design, pilot, and implementation of 5 referral pathways in Atlantic Canada and Quebec. These pathways embed referral strategies into the cancer system so that healthcare providers are systematically referring survivors to services that are available to them. They also made extensive improvements to their cancer services locator, which is a database of cancer services across the country. And these are resources that include things like mental health support and onco-fertility resources, which I'll talk about in a second. They also help to drive more traffic to this cancer services locator through a widget which they embedded on a number of websites, so driving people to it that might not know about it otherwise. And the screenshot of the widget is on a slide here. So next, we know from the transition study that adolescent and young adults are a particularly vulnerable group with many unmet needs, emotionally, physically, and practically. In 2020, we sponsored a virtual Young Adult Cancer Canada conference, and we further surveyed this group to share their primary care experiences after cancer treatment. Overwhelmingly from this, AYA cancer survivors said they wanted their primary care providers to be more proactive and more aware about their post-treatment needs. And so in response, we developed 2 infographics shown on the right of this slide. This is just a small snapshot, but they're actually quite long infographics themselves. This gives a flavor of what they look like. They contain key clinical questions that primary care providers can ask their patients, a case study with an AYA patient themselves, and key resources and supports on common issues. We do also have editable versions available so that institutions can add their own local support resources and tailor it. And in addition, we did create a short accompanying video for primary care providers. Finally, another stream of work at the partnership for AYA survivors is our onco-fertility initiatives. This work comes out of the transition study and interview findings that fertility can be a major source of distress for adolescent and young adult patients. Many young patients are not made aware of the risks of infertility as a result of their treatment, and many are also not made aware of the opportunities to preserve fertility prior to cancer treatment. So to support oncofertility, we have published a business case for oncofertility screening in the cancer system, and we are working with some provinces to implement automatic screening prompts about oncofertility into their electronic health system. And we've co-designed a prompt for patients, and the prompt states, some cancer treatments could negatively impact fertility or reproductive health and the ability to have biological children now and in the future. I would like to speak to a healthcare professional about this. That's the prompt. And based on the patient's response, they can then be connected with those services if needed. Finally, on this slide, you'll see an app prototype called Candle. This was created by our partners at the Canadian Cancer Society in response to feedback from AYA survivors about their informational needs. The design and function of this app was co-created with young adult cancer survivors through surveys, then focus groups, co-design workshops, and then finally a prototype usability testing session. Next, another targeted initiative for us was supporting cancer patients' return to work. This was one of the biggest practical concerns that survivors reported in the transition study. We commissioned an environmental scan on mental health and return to work needs of cancer survivors. I did mention that a little bit earlier in the presentation. As well, we have worked with our partners at Cancer and Work to create an e-course for primary care providers to learn how to support cancer survivors with practical return to work needs. And this course is self-paced and it's freely available online on the UBC CPD platform. Next, just a quick preview of our current implementation work in survivorship. We have currently a Models of Care funding initiative, which has projects across 4 streams. All projects must fit into one of those buckets: early diagnosis, treatment, survivorship, or palliative care. And we currently have a number of projects in the pipeline across this country for this initiative. In this business cycle, as an organization, we're really focused on equity to address the needs of those who are systematically excluded from the health system, and also to our commitments to reconciliation. And so in this initiative, all the Models of Care projects do have an equity component with a focus on one or more marginalized groups. The aim with this funding initiative is to have a cohort of projects across the country that can collaborate in a community of practice and learn from one another as they go along about community engagement, evaluation, equity, and what works to address the current healthcare capacity issues. Next, just a flavor of the kinds of projects that we have in the works. Our call for proposals based on the slide before was fairly broad, but generally the themes for the projects we have can be seen on this slide. We have many projects focused on patient navigation at very different points in the cancer journey, some coming in, some coming out, some within. We have projects on collaborative care teams. Some projects to help address capacity issues are looking at increasing scopes of practice for different healthcare providers. And we also have data-driven initiatives. For example, building in referral pathways and risk stratification based on patient-reported outcomes. Okay, next slide. And lastly, I realize that I have thrown a lot at you today, and especially there's a lot of different links in all the different slides that I provided. So I want to announce that right now we're working on some improvements to our website so that there will be a dedicated survivorship space where you can find information and resources about what we and our partners have accomplished. This work is still in progress, but we do aim to launch in the coming months. So please do check back on our website and keep an eye out for that. And with that, I will hand it over to Jessica to talk about our system performance reporting.
Excellent. Thank you, Amanda. I do see some familiar names on the list here, which is great. For those of you that I have not met, I am Jessica Kitchen, and I am joined with Kim Tran from the System Performance team here at CPAC. And we'd like to switch gears a little bit now and talk about our upcoming System Performance Report. If we can move to the next slide. So I'm going to start off with a quick overview of our system performance reports, and then we'd like to spend most of the time getting your feedback on what we could potentially measure on a pan-Canadian level within the survivorship space for our next report. Next slide. So to start off with a little bit of background on what we're talking about, system performance reports use standardized indicators, which means that we're able to measure and compare system performance across jurisdictions and over time. And so in terms of what we've done in the past, from 2008 to 2018, CPAC has worked with partners across Canada to release annual cancer system performance reports. And these included indicators spanning the cancer control continuum. However, survivorship has not previously been included as a theme in our reports before. So we are very excited to be here today to talk to you about what we could potentially measure within this space for our next report. As I mentioned, the last report was released in 2018. And since then, we've heard from partners around the importance and the value add of having that pan-Canadian comparative analysis. So as I mentioned, we are planning for our next report with tentative release in 2025-26 and data collection starting in the fall this year. Next slide. So just for some context on why we do system performance reporting, there are many benefits to collecting and reporting on standardized indicators, and that they include, for example, identifying gaps and promoting continuous improvement, helping to refocus public, media, political attention to the importance of maintaining investment in cancer control, informing evidence-based policy planning and practice changes, and providing an opportunity to deep dive in specific thematic areas to identify potential factors that are driving the variations that we see. Next slide. And so here on this slide, you can see the themes that we've landed on for our upcoming report. And so we have themes spanning the cancer control continuum, as well as equity stratifiers, patient-focused indicators, and value-based care indicators, which will be embedded across all the themes where possible. Just for a little bit of context, these themes were identified by our System Performance Steering Committee and then validated with Partnership Council. And this includes the heads of provincial and territorial cancer agencies and programs, as well as surgeons, medical and radiation oncologists, data experts, and then patient and family advisors. And so you can see circled in yellow, survivorship as one of our themes that was prioritized for inclusion. And since this is a new area for us for these reports, we are very excited and thankful to be here today to get your input on what we could potentially measure in this space. We know that the number of survivors continues to grow. There are many late and lasting effects that impact patients in survivorship. So it is really a really important area to measure and to draw attention to at that pan-Canadian level. Next slide, please. So before we dive into the specifics, I just wanted to go over a few things to kind of keep in mind as we're thinking about indicators. So first off, we want to ensure that the indicator is accessible and easy to understand. It needs to be relevant and represent something that is meaningful to patients, providers, and our policymakers. We need to think about robustness and transparency of the indicator. So for example, is there compelling evidence to measure that specific thing? And is there high quality data available? And I will mention that for some of the themes within our report, we are leveraging indicators and data from external sources, and then we'll refer to those external reports in our system performance report. Whereas for other themes, we'll be leaning on partners to collect the data. So if there is something that you're working on that you think we could potentially leverage for the Pan-Canadian report, keep that in mind, because we'd love to hear if there are opportunities to kind of align and collaborate. The next consideration here is around usefulness. So we want to make sure the indicator is actionable and that we can do something with the results to affect change. And then lastly, we want to think about whether the indicator is future focused and will continue to be relevant and feasible in our health and data systems as our health and data systems change over time. Next slide, please. And so now we're going to dive a little bit deeper into the survivorship theme, and we will switch gears, and you'll get a chance to provide some feedback on what you think might be valuable to explore for inclusion in our system performance report. So you can see here on this slide, we've put together a list of potential indicator concepts. We're just bringing these forward as a starting point for discussion. And so you can see we've kind of blocked them into focus areas here. And once we've identified our focused areas, then we can kind of dig a little bit deeper into the specific indicators. So what I'm going to do is I'll go through the indicator concepts, and then you'll have a chance to use the annotation tool in Zoom to vote, and then we're going to open it up for discussion to dive a little bit deeper. So to start off, the first concept that we have put on our list here is specific to post-treatment transitions in care. And so, for example, this might include indicators looking at whether patients and/or providers were provided with treatment summaries and follow-up care plans after they completed treatment and were transferred back to their primary care provider, for example. The second concept here is looking at post-treatment care itself. So, for example, looking at whether patients have access to psychosocial and supportive care services, or looking at whether there is concordance with surveillance recommendations specific for cancer survivors. We could potentially look at quality of life post-treatment among cancer survivors versus adults without cancer, or look at whether patients in survivorship were screened for distress. We could look at primary care education. So, for example, whether there's training available to primary care providers to support patients in transition, to support patients in survivorship, for example, like monitoring for recurrence, cancer prevention, and management of late and lasting effects. We do have a research theme within our system performance report, and that will look at adult clinical trial participation and investment in cancer-related health services and policy research. But we could also look at investment in survivorship-specific cancer research, like Kim had shared previously. And then we also do have a long-term outcomes theme within our report, which will look at incidence and mortality rates, as well as net survival. But we could also look at things like years lived with disability or prevalence of cancer survivors. And then you'll see the last row here, I've put other, because there could be other concepts that you have in mind that you think might be valuable to measure. And so I've put this other category here. So if you think of something, you have something in mind that's not captured in one of these buckets here. And when we do our voting, please feel free to add your vote to another category, and then you can share any other ideas that you have. And so now we're going to attempt to use our annotation tool, and fingers crossed this works out for us. So at the top of your screen, there should be something that says View Options. And if you click on the View Options, there should be a drop-down that opens up, and you can click on Annotate. And then on the left-hand side of your screen, there should be a bar that pops up. And if you scroll down, on my screen, it's the fourth icon down. It looks like a little check mark. If you click on that, it comes up with a stamp, and then you can click a stamp that you like. Fingers crossed this works. Okay. I see some people coming on, so that's great. So I'll give you a minute or two here to kind of think about if you had to pick only 3 from this list, and you can include the other if you've got something else in mind. Please use the annotation tool to add 3 stamps for the top 3 concepts that you would prefer to see explored for the system performance report? This is great. I'm so glad it's working. So it looks like that quality of life post-treatment transitions are definitely top ranked as of right now. This is great. I don't see any votes for the other category yet. So hopefully we've captured the key concepts here. If there is something else, feel free to add a check mark to that other box. This is great. Maybe before we get into our specific discussion questions, I'll just open it up for any comments, any thoughts on any of these items here. Do these resonate with you? Oh, I see a hand up. Carmen?
Carmen, is that, yes?
Yes.
Yes,
Go ahead.
hi. Thank you so much for this exercise. I was trying to tick other, but I wasn't able to do it. So my comment would be that when we talk about indicator concepts, I forgot to introduce myself. So I'm Carmen Loisel. I'm a professor of oncology and nursing at McGill University. And I think increasingly we see survivorship as maybe a graded concept, so that when we talk about post-treatment, there's so many new treatment now, and we're seeing survivors going through post-treatment and then recurrence and another post-treatment and another recurrence. So I think moving forward, we probably need to capture the intensity of survivorship or the chronicity of survivorship, so that we don't just lump all survivors into one category. Some people will get treated, never have a problem, move on. They still call themselves cancer survivors, but no issue after a first line of treatment. But you see increasingly people that will chronically come back to the system with different symptoms and different treatment needed. So how do we capture this to ensure that when we're describing or capturing indicators in survivorship, that we really know what are the profiles of those survivors, because it's not one homogeneous category. So that was my thought. So that would go into other, where we attempt to capture that diversity in survivorship.
Mm-hmm. Yeah, those are really, really great points. So if there was some way to kind of stratify by people who have had a primary cancer, they've been treated, they're in the survivorship stage, they move on, versus people who have had a second primary or a recurrence, and like the impact, the intersectionality of all of that coming together and the impact on their lives.
That's right, because it will affect everything, whether it's quality of life, whether it's, follow-up care. So I think we need I would call it maybe a more granular description of what we mean survivorship. Thank you.
That's great. Thank you. Are there any other thoughts or comments on any of the concepts here?
I was wondering, Carmen, do you know of any work that's already being done in this area that we could look at to explore further?
A great question. I mean, it's something that popped in my mind as I was thinking about what I'm seeing in clinical settings. And so I I'm not aware of any work. I wonder if, I think Margaret Fitch is on the call. I wonder if she's been really involved in a lot of this work. So maybe she has some insight that I do not have.
Thank you.
I do have some specific questions. So maybe Kim, if you could just plop them in the chat so that we can still look at the concepts here. So my first question is around thinking about these concepts, and it looks like post-treatment transitions and quality of life post-treatment are kind of the top ranked ones here. If we dive a bit deeper from the concept to a specific indicator that we could measure, thinking about like feasibility of data collection, data quality, impact, do you have any suggestions on specific indicators that we could further explore for inclusion in our report?
Just while people are thinking about that, let me weigh in on Carmen's invitation.
Yes.
To comment. Sorry, I was having difficulty trying to get out of the annotation.
That's okay.
But anyway, I do think that notion of everybody being different and the kinds of factors, if you will, coming into play are going to have different combinations. And I know at this point in time, I've been collaborating with a colleague in British Columbia, looking at social factors and the kind of factors that come into play and group people with different profiles. It's just initial work, and he has a statistical approach that is being used. So it'll be interesting to see how that works. But I think the idea of the various combinations and how they come into play at different points in time for different reasons is really part of what we have to think about going forward. How do we match services with individuals given the uniqueness of life and lived experiences? There is also the whole area of rehabilitation. And I think we need to be drawing on some of our colleagues in rehab, speech pathology and physiotherapy, thinking about some of the long-term effects that people are dealing with.
Thank you, Marga. I knew you would have great insight into this. And so I think as we're thinking about the concept of survivorship, there's the notion that it's different for each, but also the notion that it's very dynamic. And so when we just limit ourselves to a definition of post-treatment, I think we're missing that richness of what Margaret Fitch just described. So how do we capture that, and how do we ensure that it's not just this big category of post-treatment, but that in fact there might be gradient of survivorship, just like there are stages of cancer, you know. So I would just invite us to think more about this, I guess, the variety of the concept of survivorship to make sure we're measuring the right things.
Can I say a word or two, just as a researcher who's been bringing the research evidence, working with the clinicians, with the decision makers at the management level, etc. I mean, this is an interesting question. What would you like to see indicators? And there was some mention also that looking forward and being able to predict what the future will be bringing, so that that's built in, because we're often 5 to 10 years behind in the research that's being done because times have passed. But the combination of measures and in terms of post-treatment transitions in care, as a person, as a patient, is going to have a variety of options, as Mark said, and each person is different, and each person will have different needs. And I think this is why we now are very much including patient perspectives in the research itself, and supporting patients to be part of the research team. I think we should continue that. But I'm a population and public health researcher. We get back to the epidemiology and the in terms of population health measures, and survivorship is measured at that population level. And that part is also very important because it may sort of boil down things to law of averages. On the other hand, the decision maker at the government level and also at the regional health level, anyone outside an organization that's a hospital or a community organization that only cares about or that only focuses on their own patients will want to see these more generic pan-Canadian as well as pan-provincial. Of course, we can go on to talk about global health and how immigration and equity and et cetera is going to be taken into consideration. So it isn't one or the other. We need to look at it, we need to sort of slice that donut in different ways to see where maybe some of the points meet, but there's not going to be everything that looks like it's wonderful at the population level. It's going to work for individual care level and vice versa.
Yeah, some really great points. In terms of what we measure and specifically, well, I guess we'll have to do some digging. And I think based on feasibility of stratifying and getting that granularity, I don't know whether it's possible right now, but I think these are some really, really great points that we could include in the narrative. If we can't report on it, we can expand on that within the report itself to give that context that it's not a homogeneous population. There is a lot of variation within that group. I see that I'm just looking at the time. Oh, Carmen, go ahead. Did you have something?
I just wanted to say that maybe one or two questions within the background sociodemographic questions might get at that intensity of survivorship. I can get my head around it, and maybe we can collaborate in thinking about what those 2-3 questions would capture in terms of that granularity. It might work really well just to ask a couple of questions in the background to get at that notion of chronicity in survivorship.
Yeah, that would be fantastic. I'm looking at the time, and I feel like we could keep talking about this, but I know that this only goes till 2:00. So if you do have any other ideas, feel free to reach out to us. I know we're going to share an email afterwards, and so feel free to reach out to us if you have other thoughts. And Carmen, if you're open to it, we'd love to connect and kind of expand and figure out where we go from here. If anyone else also wants to join that conversation, please let us know, because we would love to collaborate and dive a bit deeper here. So thank you everyone for your feedback.